In this video, we'll be discussing an essential medication often encountered in nursing practice, which is lamotrigine. This medication is commonly used but can have significant effects on the body, requiring careful nursing considerations. Let's dive into its indications, action, adverse reactions, contraindications, nursing responsibilities, and patient education. Vital Nursing 101, your ultimate guide to nursing success. Starting with indications. Lamotrigine is an anticonvulsant medication primarily used for the following indications: treatment of epilepsy, management of bipolar disorder, and off-label uses. Let's take a moment to learn about each indication now. Treatment of epilepsy. It's effective for partial seizures, generalized seizures, and Lennox-Gastaut syndrome. Management of bipolar disorder. Specifically, lamotrigine helps prevent depressive episodes in bipolar disorder. Off-label uses. Occasionally, it's prescribed for conditions like trigeminal neuralgia or certain mood disorders. As nurses, recognizing why a patient is taking lamotrigine is crucial for providing appropriate care. All right, moving along, let's now learn about the action of lamotrigine and how it works. Lamotrigine's action revolves around stabilizing neuronal membranes. It works by inhibiting voltage-sensitive sodium channels in the brain and reducing the release of excitatory neurotransmitters like glutamate. This results in fewer seizures and improved mood stabilization for patients with bipolar disorder. Adverse reactions. Like all medications, lamotrigine has potential adverse reactions. Here are the most common and serious ones. Common side effects: dizziness, headache, blurred vision, nausea, fatigue. Serious adverse reactions: Stevens-Johnson syndrome and toxic epidermal necrolysis. These life-threatening skin reactions require immediate discontinuation of the drug. Aseptic meningitis, rare but severe, presenting with symptoms like fever, headache, and neck stiffness. Suicidal thoughts, a known risk with many anti-epileptic drugs. Be vigilant about monitoring for these reactions and educating patients to report symptoms promptly. Contraindications. Lamotrigine is contraindicated in patients who have a known hypersensitivity to the drug. It is also contraindicated in patients who are younger than 2 years old for seizure indications. Additionally, caution should be exercised in patients with a history of rash when taking other anticonvulsants, and in those with severe hepatic or renal impairment. Nursing considerations. Remember that as nurses, we play a critical role in ensuring the safe administration of lamotrigine. Here are some nursing considerations. These considerations include assessment, skin checks, titration, and drug interactions. Assessments. Monitor seizure frequency or mood changes to evaluate drug effectiveness. Skin checks. Regularly assess for rashes, particularly in the first 8 weeks of therapy. Titration. Lamotrigine dosing requires a gradual increase to minimize the risk of rash. Never double up on missed doses without consulting the healthcare provider. Drug interactions. Be aware that lamotrigine's metabolism can be affected by other medications, like valproate, which increases lamotrigine levels, or enzyme inducers like carbamazepine, which decreases its levels. Be proactive in collaborating with the care team to adjust doses based on patient needs. Patient education. Patient education is critical to ensure safe and effective use of lamotrigine. Highlight these key points. Adherence. Stress the importance of taking lamotrigine exactly as prescribed to avoid breakthrough seizures or mood instability. Rash warning. Instruct patients to report any rash immediately, as it may indicate a serious reaction. Avoid abrupt discontinuation. Stopping lamotrigine suddenly can increase seizure risk or worsen bipolar symptoms. Pregnancy. Discuss the risks and benefits of lamotrigine use during pregnancy, as it's associated with a low risk of birth defects but should be closely monitored. Other medications. Advise patients to inform their healthcare provider about all medications they're taking, including over-the-counter drugs and supplements. Remember that clear communication ensures patients understand the significance of adhering to their treatment plan. Lamotrigine is a versatile medication for epilepsy and bipolar disorder, but it requires careful monitoring to ensure patient safety. By understanding its indications, mechanism, adverse reactions, contraindications, and nursing considerations, you'll be better prepared to provide optimal care. Your role as nurses includes educating patients, monitoring for adverse effects, and collaborating with the healthcare team to promote the best outcomes. Alright, well, that ends this nursing review. If you found this video useful, leave a like and a comment so we can continue to make more videos like this. Also, if you have any study tips, leave them below. I'd love to hear from you.